To Capitol Hill, where we are now getting reports that some lawmakers are so eager to read that just-released Senate GOP bill that they're delving into it on the sly during their other committee hearings because they want to see what's in it. Senators and the media got their hands on the 142-page-long Better Care Reconciliation Act of 2017 about 4 hours ago, and as opinions on it start blasting out of D.C., here's some of the key bullet points of the proposal that you need to know. The Senate bill eliminates all requirements for both individuals and employers to purchase health insurance. It phases out Obamacare Medicaid expansion over 4 years, starting in 2020. And after December 31st of this year, no more taxes on the medical device makers. And it also repeals the 3.8% net investment income tax, retroactive to the start of 2017. But the Senate plan does leave in place key components of Obamacare. Americans with pre-existing conditions will be continued coverage, and the bill allows children to stay on their parents' health insurance through the age of 26. That was very popular. Now, right now, we have the health care bill rollout and protesters who earlier erupted in the hallways of Capitol Hill, disabled folks, many in wheelchairs, upset with what they feel is a bill that leaves their coverage in the cold. We bring in Congressman Kilmer, who is the co-chair of the House Bipartisan Working Group, Derek Kilmer, and Congressman Mark Amodei. To both of you right now, welcome. He's a Republican. Oh, he's not there yet. I'm so sorry. We're waiting on Congressman Amodei, but you guys work together. Let me get to you, Representative Kilmer. As a Democrat, give us first your thoughts on the Senate bill.
Well, I'm really concerned about it, mostly for the people I represent. I've met with a lot of people who are dealing with real health problems, and they're concerned about this. I met with a person at the Hilltop Community Health Center in Tacoma who said, I have cancer, and I only have health care because of the Medicaid expansion, which is ended by this Senate bill. I'm also concerned, I don't think the Affordable Care Act is a perfect law, but a lot of the concerns that we've heard in terms of things that are causing instability in the insurance market are not fixed by this bill, and I think we can do better.
Representative Amodei, can you hear me? I know you just got out of a meeting and you're joining us. Can you hear us?
Yes,
okay.
Ma'am. How are you?
Very well, thank you. You and GOP House members passed your version of the bill weeks ago. Do you see any stark differences in what you voted for versus what the Senate revealed today?
You know what? We've been pretty fully employed so far today, so I'm told that it may lengthen out the Medicaid stuff a little bit, but to be direct, I haven't had a chance to go through the Medicaid portion of it, which is the area that we paid particular attention to when it was over here on the south side of the building. So, too early for me to answer that for you authoritatively.
Well, let me just illuminate you. It targets, I guess, starting in 2020, gradual reductions in the amount of federal money that was provided under Obamacare to expand. So by 2024, it's pretty much done, I believe, and even representatives like Peter King of New York say it's a good bill, but he'd prefer that particular part of the train slow down. That car of the train, he feels, goes too quickly, 4 years versus the 7 years I think the House bill had.
Well, we'll take a look at it. I'll tell you that obviously the steepness of the off-ramp, if you will, is something that we paid particular attention to for its impact in Nevada. In terms of making sure that nobody was kicked off. Of course, you got to look at the other issue there, which is none of this happens in a vacuum. So as the job market continues to improve, which it is in Nevada, which is my first responsibility, and we know that half of the people in Nevada get their health insurance through employer coverage, then we would expect that to take up some of the slack. The other thing that I think is phenomenally underreported is that once you're on the expansion, the House version allows you to stay on it until you're Medicaid eligible till 65.
Let me bring in Representative Kilmer again. Congressman, we know Senator Schumer, Democrat from New York, has called it heartless and, quote, even meaner than the House GOP bill. But I have to ask you, in your opinion, how is it totally heartless if it upholds the most popular Obamacare rules like coverage of pre-existing conditions and allowing kids to stay on their parents' plans till age 26?
Well, I think you've already heard that there continue to be concerns about how this affects what's known as the essential health benefits, not just pre-existing conditions. And it's why you've seen some of the medical groups and groups like the American Cancer Society raise concerns about this bill, because it will have impacts on sick people. And, you know, as I mentioned, I don't think the Affordable Care Act was a perfect bill. I think there's changes that ought to be made. But if you're going to make, there's a difference between change and progress, and I don't believe that this bill makes progress, certainly for the folks that I represent. And you know, and in defense of my colleague, I think part of the reason that there's a lot of questions about this bill is when it's written behind closed doors and doesn't see the light of day and doesn't have public hearings or public testimony, the voices of my constituents have not been heard in this process, and I think that's why you have an outcome that's causing a lot of concern.
But we've got to run, but Representative Amodei, I need to tell you that there's a new Wall Street Journal NBC poll that just came out in the last hour. Don't know if you've heard, but overwhelmingly it appears that 1 in 3 Americans disapprove of the House health care bill that you guys voted upon. What do you say about that?
Well, I'd like to see it in a head-to-head with the status quo for people in, most recently, Wisconsin, and I believe it's, is it Iowa or something, that have lost, of all people, Anthem. So, I mean, it's one of those things where, quite frankly, there is no political sweet spot, and the status quo is not working, so I'd rather be criticized for trying to do something than sitting there and watch Rome burn.
Okay, before we go, both of you, do you see yourselves working together now to at least get something passed before the entire situation spirals down?
Well, listen, on health care, I think you've seen a fundamental difference between the two parties.
Is that a no?
Well, here's what I would say. If there's an attempt to solve a health care problem, I think there's opportunity for bipartisanship. If it's simply about solving a political problem, for folks who've said for 7 years that we need to repeal the Affordable Care Act, I don't think there's common ground to be found there. I think there are improvements that can be made to the law that will cover more people, that will reduce prices. That's not what's on the table in Congress right now.
And we'll finish with this. Representative Phil Rowe was on this show a couple of days ago, and he said he would absolutely work through the August recess to get this and tax reform done. Would both of you, you can say it together, yes or no, would both of you give up your August recess?
Yes.
Yes.
Great to hear. Gentlemen, thank you. It's good to see you both standing together, talking together, working together. Congressman Mark Amodei and Derek Kilmer. Great to have you. Republican and Democrat.